Hi, I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society, and I am thrilled to be joined today by Dr. Susan Kellogg-Spott. Susan, tell everybody who you are and what you do.
Hi, I'm the Director of Sexual Medicine at the Center for Pelvic Medicine in Bryn Mawr, Pennsylvania, and Professor of OBGYN at Drexel University.
So we're going to talk about a topic for healthcare providers that we often do not bring up, and that's the issue of sexual arousal. So explain first what that means.
When women have difficulty with sexual arousal, they say things like, I just don't feel like I'm lubricating. I don't feel turned on. I don't feel incented to be turned on, either with erotic cues or non-erotic cues, like erotic reading or watching a movie, something like that. They just feel dead down there.
How common is this? Is this a common issue for women?
You know, it's a little bit more common than you think. Studies suggest it's somewhere between 7 to 11% of women, but the truth in clinical practice, it's more like 25% or 1 in 4.
1 in 4. So as 1 in 4, this is something that definitely we're going to come across as we're practicing.
Absolutely.
But it seems to me that we lack sometimes the verbiage in terms of bringing this up, or patients may feel uncomfortable in bringing it up to us, that sort of embarrassing conversation. How can we get women to recognize that this is a safe place to be bringing it up and this is how you should do it?
So most often women think that this is just their fate. They're postmenopausal. This is what happens to older women. And in fact, it can happen after menopause, and it should be normalized for them. That's something like this. You know, after menopause, a lot of women talk to me about changes in their sexual response. Is anything like that happening for you? You see, it invites the women to then enter the dialogue rather than getting the entire onus to bring it up on her. That's
and makes you feel like you're not alone.
Yep, exactly.
Okay, so now you've identified this. I would imagine it's received with a great sense of relief if this is an issue or a concern for you. Where do we go as healthcare practitioners next?
Well, I think in terms of treatment, let's further define the issue and really hone down on what is it that you used to experience that you no longer experience, and does that cause distress for you? But then really individualize care and find out what the woman is willing or interested in trying, because there are so many treatments. There are some that are over the counter, some that are prescription, some are hormonal, some are non-hormonal, some are even mechanical. So really kind of introducing the topic of, I have lots of things I can offer you. Do you have anything in mind, or do you have anything that you absolutely want to stay away from?
And even when they want to stay away from something, is it worth us exploring why? Because often there's myths associated with what they may want to stay away from.
Sure. I mean, one of the easiest interventions for dryness and chafing and lack of responsiveness is local estrogen therapy. We have lots of options and some new ones that are really exciting as well. But women, when they hear hormones, sometimes they think immediately systemic hormones. No, don't give that to me. When in fact, local estrogen therapy carries a completely different level of risk, much lower, and is really just what might help the woman so quickly.
So for women who are reluctant to come in and bring this up as a conversation, what are they trying over the counter?
So they're trying lubricants and moisturizers, obviously, and you know, those are really great for mild complaints, but by the time people are distressed over this is moderate or severe in terms of its impact on their life. They just really are not getting moist, or they're really not feeling their heads connecting with their body at all. They feel dead down there. So you probably are going to want to use something more than a lubricant or a moisturizer. Other times they go to internet ads for things like horny goat weed or something like that. And there's really not a lot of medical research.
Buyer beware.
Buyer beware. But you know what is easy? It's an anonymous. They don't have to talk to anybody. That's why it's so important to talk to patients.
And if in fact you correct the issues associated with vaginal dryness and correct some of the issues, for example, with painful sex as a result of vaginal dryness, but women are still noting that there are issues with arousal, what next?
Well, let's talk about some over-the-counter products that do have evidence as their basis. The things that these products have in common is that they have high levels of L-arginine. That's an amino acid. It's actually a precursor to nitric oxide. That's the pathway that Viagra works on. So if you think about what it does, it actually increases blood flow to the genitals, or it's vasocongestive in its nature. And there's things that have been looked at both at their primary study, but then replicated studies showing the same response. Some products that would be included in this are things like Arginmax, A-R-G-I-N-M-A-X, Arginmax for women, very well published data on that, and also something like Stron Vivo, that's STRONVIVO. That was actually conceived and tested at Baylor University, Department of Urology, for men and women. So those are both L-arginine-based products. Another topical oil is called Zestra, Z-E-S-T-R-A. Zestra is available over the counter. It is a blend of borage seed oil, oil of angelica, and oil of evening primrose. What do those oils have in common? They are also vasodilatory, and so when it's applied to the surface of the skin, it increases blood flow where it's applied. One word of caution with any oils on the genitals, they're best used on skin that isn't right at the vaginal opening, so like skin like the labia on the outside, or the prepuce, which is the hood of the clitoris, rather than inside the vagina. That's not where they're meant to be used.
And if by accident they do end up there?
It causes some burning, some stinging, no permanent damage, but they should be washed off.
Bottom line, as healthcare providers, is this something that we should be making part of our agenda?
Addressing arousal disorders in women, absolutely. And if we're not using over-the-counter products, things like local estrogen therapy, absolutely.
Thank you so much for joining us today.
You're welcome.